Let's talk about spreading of vitiligo. What causes the spreading of vitiligo? So there are many reasons. I will start with stress and anxiety, depression. Psychological problem is the main cause that causes spreading or stopping the results you're getting for treating vitiligo. So let's suppose saying that you found a treatment that's giving you really good results, and then you had some psychological stress. Well, psychological stress will stop the results of this and might cause spreading of vitiligo. Second reason I would say, which might change from time to time, and this is a very important factor to consider, that it's changing from time to time, meaning that you can reuse the treatment that you didn't find it useful and you would find results in later time. These factors that change from time to time is biological and environmental. So let's say sometimes you came in a specific period of time in a year and you tried a treatment that didn't work, and then you came next year, and then next year you use the treatment, the same treatment, and you find it working. Or the opposite, you were using a treatment that you would find working, and then you come next year and it's not working. I'll explain now the reason why is this happening. The environmental effects on the biology or biochemistry could be from the weather, could be from pollution, could be something we ingest, eat. Even that in a specific period of time that our body didn't have any reaction to it, this reaction could later be happening, could be triggered. So we have to watch this. We have to keep it in mind that this environmental factor sometimes specifically comes in a certain time of the year. Like let's say for some people, it could be every summer, some people every winter, some people every autumn. It really varies. And it could be changing from time to time. Like let's say you had this in autumn this year. If it's happening every autumn, then you know that this period is difficult for your vitiligo. If it's happening different period of time of the year, then it's something else. Could be nutrition, because some nutrition will boost our immunity in a way that will affect our autoimmune condition. And some are pro-inflammatory stuff, and some are related to diet, like egg, dairy product. And this also varies. Some people, they don't need to do diet. They're finding really good results with or without diet. There are chemical influences too. Like some people would, like say, they would, I'm coaching them, I'm following up with them. They would say, oh, we went for vacation and we had spreading in our vitiligo. I would ask first, did you had long hours of sun? I mean, sunbathing, or you were walking under the sun for many hours without sun protection? Because sun is a treatment, but only for a few minutes. We only need sessions of this UV. If we expose ourselves for hours, then this is not good. It might cause spreading of vitiligo or appearance of new spots, or stressful to the skin. And this is what causes vitiligo in the first place. It's a stress happening. We have our melanocyte weak. We cannot tolerate. Our psychological stress will affect an elevation of reactive oxygen species or reactive nitrogen species in our body in response to stress hormones or whatever would affect us. And the same thing with chemicals like that affects our melanocytes or the color pigment in our body, like bleaching compound. Now, bleaching, it's an oxidation. It's the same thing, and they place it in like swimming pool to disinfect the swimming pool. They place this disinfectant there. It might be okay for others, but elevation of this bleaching components and halogens is not okay for us. So this is another thing to consider. If we have vitiligo around our lips, then toothpaste should be also halogen free of fluoride or halogens. There are some toothpaste like that. So the spreading of vitiligo, if we call it a spreading, can be divided into two. One, it's an actual spreading with this, there's new spots or expansion of the current spot. Two is actually, it's not a spreading, it's an areas where the melanocyte died, but there is a pigment there. So it's not visible vitiligo. We have vitiligo in these areas, but it's not visible to our eyes. And, medical doctor use wood lamp to view these areas with this violet, dark blue light. And this is actually an actual vitiligo that we should treat. We shouldn't be scared of, oh, I viewed it under the wood light. It's actually my whole face. It's not just an areas around my eyelid. Well, then place the treatment for your face. For every area that is obviously under the wood light shows that you have a hidden vitiligo, then we should treat it. And once you treat it, there is, people varies with results. Some of them, these areas got covered under the wood light, so the vitiligo does not appear, but it got treated. So the melanocyte will come back while the pigment is still there. Other people, unfortunately, this pigment, because it's just a color, they will lose the pigment during the treatment, which means that vitiligo will appear visible. It was invisible because of the pigment there. Melanocyte, though it's dead, there is no melanocyte, but just remaining pigment. While we are treating this area, some people will first, this pigment will be broken down, it will be white colored, and then it will be treated after that. So yes, different people have different responses. That's why we regularly check blood profile, because other things, other biochemical markers can affect this. So if you have these markers, we expect that you wouldn't have results, or you have spreading. You have to treat vitiligo from inside and outside.